it's almost funny, isn't it? We used to think about AI in healthcare as something out of Star Trek, like way out there. Now it's like it's stepping off the starship and right into our hospitals. Wild when you think about it.
It really is. The speed at which this whole field is changing is pretty remarkable. And you've given me some fascinating stuff to dig into. These research articles you've got here, really interesting stuff.
Right. Like there's this one about how an AI program at Stanford, no less, helped a doctor diagnose a rare disease crazy fast. I mean, the doctors were stumped, completely stumped, and this AI system just swooped in and was like, hold my algorithms, folks, I got this.
Yeah, and it's a perfect example right there of how AI can take in these massive amounts of data, sift through them, and make connections that we might miss. Think about electronic health records, all that info, or EHRs, as they're called AI, can be a huge help there. And this isn't about replacing doctors at all. It's about giving them this powerful new tool, right?
It's like we're so far beyond those old school what are they called? Rule-based systems like MYCIN.
Oh, yeah.
I remember reading about that. It just seems so clunky. Like you practically had to program in every single symptom and every single diagnosis by hand.
It's true. And you know what? MYCIN was completely groundbreaking back then. But yeah, it had its limitations.
Yeah.
Because you needed those very specific rules, right? Now, though, we're in the age of machine learning. Sophisticated algorithms that actually, well, they learn and adapt on their own just by going through these mountains of data.
It really makes you realize just how much data healthcare generates these days. I mean, it's overwhelming just to think about, let alone try to analyze it all.
Oh, absolutely. And that's a key takeaway here, I think. The sheer volume of information, it means AI isn't just some cool gadget. It's absolutely essential to make sense of it all.
Yeah.
And there was that 2021 AI 100 study.
Right.
It highlighted how hospitals are already using AI in so many ways, not just for diagnosing illnesses, but even predicting patient symptoms before they become really serious. I mean, it's amazing.
So we're not just talking about some far-off future here.
No.
AI is already making healthcare, like, smarter, faster. And it seems like this is just the very beginning, right?
Oh, absolutely. We are, without a doubt, on the cusp of a massive transformation in how we think about health and wellness, and AI is going to be driving that change, no question.
So AI is already out there, making healthcare smarter. But let's get down to it. What does all this actually mean for the patients, for us?
Yeah, that's the big question, right? And the thing is, it's going to touch so many different aspects of how we experience healthcare. Like, let's talk about personalized treatment.
Okay, yeah, let's do that.
Yeah.
Because that's always sounded kind of sci-fi to me,
It did, but it's becoming very real. We're talking about AI that can look at your genetic makeup, factor in your medical history, even your lifestyle, and then, well, basically create a health plan that's designed just for you.
So instead of this one-size-fits-all approach, it's like having a health plan that's actually tailored to, well, me.
Exactly. One of these research papers, it talks about a study where AI recommended treatments for certain types of cancers. It actually led to significantly better outcomes than just the more traditional approaches.
Wow.
Yeah, it's really remarkable because it's all about using all that data, right?
Yeah.
Using it to fine-tune those treatments, make them more precise, and ultimately way more effective for each individual patient.
That's amazing. Okay, but what about things like, I don't know, radiology? I always think of those doctors looking at x-rays and MRIs all day. Could AI play a role there?
Oh, absolutely. In fact, it already is. AI is being used more and more to analyze those medical images. And, it can often pick up on things, subtle things that maybe the human eye might miss.
It's like having a second set of eyes, but, super-powered eyes.
Yeah, exactly. And those eyes, they're fueled by, well, massive data sets, years and years of medical knowledge. But again, it's not about replacing doctors. It's about giving them the best tools possible, right? I mean, there's a fascinating case study in here where an AI program actually helped identify a tiny, tiny fracture in a patient's wrist that was initially missed on the X-ray.
Wow. See, that's both amazing and kind of makes me nervous at the same time.
Right.
But it also makes you think, what other things, these really subtle things, could AI help us find?
I mean, honestly, the possibilities seem almost endless, right? And it's not just about the diagnosis itself, but also the speed. For instance, there are AI algorithms being used now to analyze those CT scans of stroke patients, where every second counts.
Yeah.
And they can actually identify those blockages way faster than humans, even highly trained radiologists.
So in those really critical situations, we're talking about AI potentially being life-saving.
Absolutely. And what's really exciting is that AI in healthcare, it's not just limited to, these specific areas. It's branching out into all sorts of directions that could have a truly profound impact on how we manage our health overall. It's an exciting time.
It's incredible to think about, isn't it? I mean, AI analyzing scans, maybe even spotting things that doctors might miss. It's incredible how fast this technology is evolving. It seems like every day there's something new.
It really is remarkable. And I think as AI starts taking on a bigger role in healthcare, it's really going to change the way healthcare professionals work. Imagine like AI handling some of those more routine tasks.
Right.
And that would free up doctors and nurses, give them more time to actually spend with their patients, actually be with them.
Yeah, that makes sense.
Hmm.
It's almost like AI could bring back a little bit of that human touch to healthcare.
That's a great way to put it. AI handling things like data analysis, helping to manage all those patient records, even assisting with some parts of diagnosis or treatment planning.
Right.
And that way, healthcare professionals, they can really focus on what they do best, right?
Right.
Which is providing that compassionate care, building relationships with their patients.
Yeah. It's a really interesting picture of what the future of healthcare could look like. But as with anything new, as with any new technology, there are always hurdles to overcome, challenges, right?
Absolutely. And I think one of the biggest ones when we're talking about AI in healthcare is making sure that these systems are developed and implemented responsibly. Like we have to make sure that they're secure.
That they're reliable.
Yeah. And that they're designed with the patient's best interests at the forefront, always.
So it's not just about the technology itself, but how it's actually being used.
Exactly. It's about having those clear guidelines, setting those standards so we know AI is being used safely and ethically in healthcare. And that takes a real collaborative effort, right? You've got researchers, developers, healthcare providers, policymakers. Everyone needs to be on the same page.
It's a lot of moving parts, but it seems like, from everything we've been discussing, the potential benefits of AI in healthcare, I mean, they're just enormous.
They really are. And honestly, it's a very exciting time to be following this field, to see where things are going, because as AI technology keeps advancing, I think we're going to see even more innovative applications pop up, things we haven't even thought of yet. And they could have a truly, truly transformative impact on healthcare for all of us.
Well, that's a great point to end on, I think. This has been a really fascinating deep dive, and I have a feeling we're just scratching the surface here. There's so much more to explore. But as AI in healthcare, as that keeps evolving, as it becomes more common, I think the key takeaway here, the thing we always have to remember is making sure it benefits everyone, not just some of us, but all of us, from the patients to the healthcare providers. Something to think about. And on that note, until next time, everyone, keep asking those thought-provoking questions.